Yali Madad, my name is Zoya Panchwani. I am a member with the Aga Khan Health Board for Canada, and I'm an MD PhD candidate at the University of Calgary, specializing in epidemiology. I'm excited today to introduce our speaker, Dr. Naheed Rajabali. He is an assistant clinical professor with the Faculty of Medicine and Dentistry at the University of Alberta. He primarily works at the Royal Alexandra Hospital on the acute inpatient ward and consult service and Geriatric Medicine Emergency Department consult service. He will be giving a presentation today on healthy aging and fall prevention. So with that, I'll hand it off to Dr. Rajabali.
Thank you very much, Zoya, for the kind welcome. Hello and Yali to everyone. Without further ado, I'll just get started on the presentation. Heard about the title. It's on healthy aging and falls prevention. We'll look a little bit at the concept of intrinsic capacity, or what we call fitness and frailty, versus chronologic age or numeric age. We'll look at the relationship between falls and intrinsic capacity and quality of life. We'll look at causes of and risk factors for falls. And then we'll talk about falls prevention strategies at the various states of fitness and frailty. And we'll also touch upon some of the concerning factors associated with falls. But first, people often ask, what does a geriatrician do? So it varies. So my scope of practice, for example, so I do internal medicine, geriatric medicine. And so we do disease management ranging from heart failure, COPD, hypertension. My practice is primarily in the hospital, managing acute patients. I also am interested in preoperative assessments. And so part of my practice is also in the community. And then beyond disease management, we appreciate that people also have a functional quality of life. And so we have additional training in the areas of behavioral neurology, so behaviors, dementia, movement disorders, psychiatry, rehabilitation, and so on. Then we also appreciate that there are some people who have very limited functional quality of life, but they still need to have dignified care. So we have some additional training in things like palliative care, management of very frail patients. All this allows us to help tailor care and then also promote healthy aging. So going back to falls. Well, falls, first and foremost, are not a normal part of aging. People may have increased risk of falls when they have diseases or comorbidities, if they're frail or have reduced intrinsic capacity. And sometimes falls are a marker of concerning medical issues. Falls are associated with an increased risk of injury and death, hospitalization, institutionalization, so going from home to a facility, loss of independence. And then they're also associated with reduced socialization. People may have fear of falling, or they may have injuries. And of course, that can also impact their mood. They may become depressed or anxious, and that also impacts quality of life. So there is a connection between falls, independence, disability, intrinsic capacity, and quality of life. They're all related. So what does healthy aging look like? Well, there's healthy physical and cognitive aging, so brain functioning. And so it looks like kind of like this, what you see here. In the middle picture, you have individuals in their 80s and 90s, and they're playing basketball. They can still likely drive and manage their finances, but still be able to cook and shovel snow if needed, right? And so compared to their younger selves, of course, they probably have slowed down. They're probably not as strong, but they are still thriving. They haven't lost their ability to be functioning. In fact, they're actually enjoying things. So that's, physical cognitive strength. Here cognitively, as you age, you should still be able to learn things. So this individual in their 70s graduated high school. And this lady here in her 80s graduated university or college. So that's healthy aging. Of course, some of us also recognize that there's healthiness. There's a sense of health beyond just the dimensions of the mind or the brain and the body. And so, there's a quote by Rumi that says, "My soul is racing. Oh, my soul is racing. Oh, my slides are racing. My soul is racing ahead of me. It says that the body is too slow for me. I'm going. So that is, of course, beyond the scope of our talk today, but I just wanted to, you cannot have a discussion a discussion on healthy aging complete without at least touching on this. Okay. So we talked about falls not being part of healthy aging, but what about disease and dysfunction? Well, they're also not normal in aging. So here, if you have, chronic disease that makes you physically weak, we call that physical frailty. So it can impact the physical self. Cognitively, if you have dysfunction or reduction in reserves in your cognitive function, we call that dementia. Causes can be numerous. You can have Alzheimer's, you can have other neurodegenerative processes, Parkinson's, frontotemporal dementia, etc., strokes, traumatic brain injury, and then you can have dysfunction from primary psychiatric disorders like bipolar or schizophrenia. Those often start young, and the odds of that happening later in life are low. So if you have changes in mood, you have changes in have new anxieties, people seeing things or talking about things aren't there, you start considering something called BPSD or behavioral and psychological symptoms of dementia. Anyway, all of this is a little bit beyond the scope of today's discussion, but to realize that disease and dysfunction are not a normal part of aging, including falls. So intrinsic capacity is a term that I've used, or fitness and frailty. And that alludes to just all of us have a little bit of, we have reserves. So whether at the organ level, so some people may have kidney disease, so their organ itself might be, have a little bit of less functioning, or they may have a bit of heart failure, they may have a stroke, so they're not cognitively functioning well, and so on. That can impact somebody at a functional level, at a bigger level, the whole body. So we call that intrinsic capacity, overall intrinsic capacity, or fitness and frailty. So at the bottom here, you can see that people here are robust or fit. As they have diminishing overall reserves, they end up becoming a bit more frail, less functioning, and so on. This has, of course, implications on many things, including falls. So what does that look like in the grand scheme of things? Well, you have a heterogeneous group. So all of a sudden, when you look at chronic disease and the aging demographic, you have people that are fit, robust, and then people that are a little bit on the frailer side. But you can also have younger people that are frail with diminished reserves. So how do you explain all that? Well, so we talked about intrinsic capacity, and in Canada, when you look at people 18 to over 65, and you measure their intrinsic capacity, so there's kind of big ways of doing that. One of the two, there's frailty index, there's a Freed model. There's many that are coming out now. So if you measure true age rather than numeric age, what you find is that there's fit and frail people across the numeric age spectrum. And so, of course, the number of people that are more frail increases with numeric age. But it also tells us that there are younger people that are not all fit, and there's older people that are not all frail. So you can't have a one-size approach to anything, including falls. And this kind of shows a bit more of the same thing. You have intrinsic capacity or physiologic reserves on one hand here, and you have age and time. And so your trajectory can be different based on your genetics, a small part of that, but your lifestyle, the number of diseases you have. So some people, can have this accelerated trajectory where at a certain age they become a bit more disabled, their falls risk increases, and then die sooner. Whereas others sort of have a more plateaued, a lesser decline. So what does that look like? Well, for example, let's just say we look at a group of 70-year-olds. We have, here, these set of individuals who are 70, and this individual here who's 70. So if you were to ask yourself, this mouse is a little bit finickier than what I'm accustomed to, so bear with me. So which one of these 70-year-olds is at an increased risk of falling, A or B? So intuitively, you would probably say B, right? So this just goes to show that not all 70-year-olds are the same. You have different reserves. We use a similar approach in kind of saying who will likely do better after surgery, who will likely have more complications, who should we look out for after this, who will likely do worse after heart failure. So we use intrinsic capacity to help guide, predict, project. So we do the same thing with falls. And right. So again, I feel like I'm kind of harping because I really want this point to come across. It's really a new concept, well, not too new, but it is. But aging is not pathological. So it's not, you should never think that, okay, when I'm older, I'm going to end up in a nursing home. I mean, if it happens, that's part of the process. But for individuals who are not quite there yet, it doesn't have to be your destiny. There are things you can do. So aging is not pathological. We have to change that process of thinking. That chronological age is heterogeneous, and we just saw that. And that it's of limited use when it comes to diagnosing, prognosticating, treatment guidance, but also limited use in promoting healthy aging and social care. So we don't look at numeric age. We're starting to look at biologic age, true age, fitness and frailty, intrinsic capacity, concepts like that. Okay. So I hope I've really kind of hit up on that point. So we're done with that. Intrinsic capacity, fitness and frailty versus numeric age. We've kind of looked at the relationship between falls and intrinsic capacity. So the less intrinsic capacity you have, or the more frail you have, the more falls you're going to have. So let's look at some of the causes of falls. Well, before we do that, I guess it's always nice to do a little bit of a quiz, right? So when is the best time to start falls prevention practices? Age 65, over age 65, when you're needing to start using a cane or a walker. C, when you're needing help with getting into a bathtub. Or D, while you can still shovel snow, do gardening, sit on the ground in Jamaat Khana. So when is the best time? Also, at what age do muscles, strength, and balance start to decline? Age 20 to 40, B, 40 to 50, over 65, or over 75. Also, where can a tailored falls prevention strategy be applied? Over 65, when you're needing to start using a cane or walker, when you're needing help with getting into a bathtub, or when you can still shovel snow, do gardening, sit on the ground in Jamaat Khana, or E, B, C, and D. Okay, we'll come back to those. So we talked about falls. What contributes to falls? How do people fall? What is it that makes some people more at risk of falling than others? I'm sure everyone's fallen by now, right? So when we like to think about it in terms of intrinsic risk factors, so factors that are in you or on you or within you. So you may have neuropathy, so numbness and tingling. You may have diabetes that's causing that. So if you can't sense your feet, you're going to have a higher chance of falling. You may have muscle weakness, vision impairment. You may have a medical illness that puts you at risk of falling. I don't like the word advanced age because we just talked about how numeric age, it doesn't mean a whole lot. We start looking at it in terms of frailty and something called sarcopenia, which we'll look at a bit more carefully. If you have dementia, you may be more impulsive, or you may forget how to walk. So your falls risks are going to be higher, and some medications might play a role. Then we look at extrinsic risk factors. If you have environmental hazards, if you have a mat that's kind of sticking out, you may trip on that. For some people, if you have proper footwear, and so on. If you have if you have more intrinsic risk factors, then these become a bigger problem. If you have good balance and strength, of course, if you trip on something, you're able to correct yourself, hopefully. But if you don't have good balance and strength to begin with, all of a sudden extrinsic factors become a bigger problem. And then there's precipitating factors or medical issues. So if you have syncope, so you might have a problem with your cardiac valve, your carotid arteries, for example, or you might trauma, something might hit you, or you might get quite ill. So that's a precipitating cause. And then all those things can lead to falls. And falls do not necessarily require precipitating factors. Some people can just gradually decline because of maybe dementia or frailty, and they can fall because of that. So although we separate all of these things just to kind of be able to frame it and find causes or find ways to targets to help, essentially they're all interrelated. Everything is interrelated. Being physically inactive, smoking, diseases. So any disease, all diseases do very similar things eventually. They cause a dysregulation in your inflammatory pathway. Other molecules in your body get dysregulated. All that sort of leads into something called sarcopenia, or loss of muscle strength and mass. And then that's also reflective of being frail. That could make you be more disabled, increase your risk of diseases, and dying sooner than maybe you ought to. And all of that's also related to falls. These things also increase fall risk. So they're all interconnected. So decline in muscle strength and balance. So we looked at sort of sarcopenia as a marker of aging and a marker of potential increase in falls. So studies have looked at different age groups. So 20 to 40, there's no significant decline. After the age of 40, there starts to be some increase in declining in body mass or muscle mass and strength. And ages 50 and over, this is population data, right? There's more profound decline in muscle strength and mass, and you also start losing a little bit of balance at that age. Of course, again, like I said, if you have diseases, all of these processes might start earlier than normal. If you are a little more fit, then maybe it won't be at 50 for you, it might be a little bit later. But this is population data, sort of on average. These are just what muscles look like under a microscope. Kind of like steak. Okay. Right. Okay. So are falls and disabilities inevitable with aging? We sort of talked about this. The answer, of course, I hope you guys at this point say no. They're not inevitable. Okay. I kind of like this picture here. So we talked about sarcopenia or muscle strength and mass on one hand, and then we can look at age, different aspects of age, so adolescence and then transit to older life. So if you look at the threshold for active life, so this line, right? And then we also look at the line for disability. There are several trajectories one can have in life. So let's just look at healthy sedentary aging. So let's just say you have minimal to no medical issues, but you do nothing. You say, well, this is what aging is about. I'm just going to get older. I'm not really going to do much else. I'm just going to coast. So if you do that, you're going to decline and decline. And at some point, the longer you live, you will become less active. So maybe not be able to play a sport, but then also you might cross the threshold of being disabled. So now not being able to shovel snow, maybe sit in Jamaat Khana, maybe not being able to clean the house, maybe not being able to bathe yourself. Now, there are some genetic variants. If your parents and grandparents gave you good genes, that may be, you may be able to wait a little longer before you cross that threshold. And if you don't have the greatest genes, well, that might start a little bit sooner for you. But we can't control our genetics necessarily. I won't get into all that stuff at the moment, okay? There's the way environment expresses your genes that count, how we live in a healthy way might express it. So that's why we leave a little bit of room for that. That's a talk for a different time. So suppose you have aging, but you have a bunch of chronic disease, COPD, heart failure. Well, what does that line look like? Well, you might get better, then you will get sick, then you'll end up in the hospital a little bit, you'll get a little better, and you start declining a little bit there, and then you're going to get worse, and then you're going to cross the threshold eventually for having less ability to function. And that also increases to falls. All this stuff is very related to falls. Okay, so the other trajectory, which is possible, is if you lived a healthy, active, and engaging lifestyle. So what does that look like? Well, if you did a few things, you're participating in physical activity or engaging in life, then you may be at a different threshold or different trajectory, and you may never be becoming disabled. You might be a bit slower than you were before, but you'll still be able to carry all your activities that you desire until you die. Oh, and then lastly, if you look at healthy aging and exercise, so you do a little more, you put a little more effort, then you might end up in this line here, the very top, where you can still be quite active, still play basketball or cricket or whatever should you choose, still do rasra in Jamaat Khana. Well, maybe not inside, but in the social hall or wherever, right? Right. Okay. So you can still be in charge of your destiny potentially, is what I'm saying. Okay. And so, right. This is, I guess, is getting into some of the studies that show this. So maybe just very quickly, this study looked at individuals 75 and over, and they separated them into frail and non-frail people, non-frail 75-year-olds and frail 75-year-olds, and they looked at their recurrent falls over 10 years. So interestingly, those that were not frail at 75 had 0 or 1 fall at the most, majority of them. And over 10 years, a few more had more falls, but not too many. So still 76.8% didn't have, only had no falls or 1 falls. If you compare that to the same age of individuals who are more frail, to begin with, more frail individuals had falls at the very start. And over 10 years, 52% had falls, and about 50% also had recurrent falls more than twice, compared to 23.2%. So frail people ended up having more falls. Also, you see the boxes getting smaller, narrower here. That means fewer frail people lived to be able to be followed up, or they just didn't show because they were not physically capable of showing up to get followed up. So this is interesting sort of hard data. Okay, so we've looked at now intrinsic capacity. We've looked at relationship between falls and intrinsic capacity. We've looked at causes and risk factors for falls and for healthy aging. So let's talk about falls prevention. So at the various stages of fitness and frailty. So we've looked at this picture before. So there are people here who are fit. What do you do about them? And should you be doing something for falls prevention? So the answer is absolutely, even if you're fit. So if you are, still capable with minimal disease, and you're still capable of running, shoveling snow, doing all that at whatever age, 60, 70, 80, you can still apply falls prevention strategies. And this is a great time to do it, right? We looked at that little gray line earlier. If you do it early enough, you will hopefully trajectory yourself away from becoming frail and falling. So what can you do at this age or this stage? This is the gray line here, right? So these are the people that are fit and robust. You want to aim to be sort of at that gray line here, still being active and not falling. Well, the easiest thing to do for falls prevention is do not just sit around. So the Canadian guidelines, the World Health Organization all say that if you just sit around all day, do nothing, or just work all day and sit, your risk of physical activity will increase your risk of having diseases. And of course, that will also increase your risk of falling, as we've seen. So you'll become sarcopenic, your muscles will shrink, become less, your balance will reduce, you will become more frail, and you will fall. So that's easy. Very first thing, get up and do something. And so the Canadian guidelines, as well as all the major articles out there, tell you to do something. So specifically, the Canadian guidelines say limit sedentary time to 8 hours or less. I think they're being generous, but listen, I'd be a hypocrite if I said, oh, it's easy to do, because sometimes, even I have to listen to these things, right? So no more than 3 hours of recreational screen time. So, if you watch one movie, that's fine, but maybe not a movie and 2 other things or 3 other things. And if you are going to be sitting, particularly for a long period of time in the day, maybe your job's conducive to that, then break up that period of time. Do something after an hour. Go for a walk. Go do something. Okay, so that's the easiest thing. So if you look at how that impacts molecules, if you are aging, but of course physical inactivity, it decreases muscle growth. It impacts a bunch of molecules in your body. Your muscles break down. You become sarcopenic, so your muscles shrink. Then that leads to more physical inactivity, and you become more frail. As opposed to that, if you exercise, it sort of reverses that process. And the molecules themselves reverse. And so now then your muscle mass increases, your strength increases, and your ability to function increases. And not only that, your molecules inside your cells, so your mitochondria, the powerhouse of your muscle, of your cells, they become robust. Your bad inflammation decreases. Not only do your muscles improve, but you breathe better, your pulmonary capacity improves, your cardiovascular function improves, you become less frail, and you fall less. So that's why you should all be exercising regularly. And so what do the Canadian guidelines recommend for the type and amount? Well, they have rules for people 18 to 64 and 65 and older. So they're pretty similar. So moderate to vigorous aerobic physical activity, 150 minutes per week. Same, right? Muscle strengthening, at least twice a week. Same thing here, muscle strengthening twice a week. But for people 65 and older, it's physical activities that challenge balance. But of course, we've seen now that reduction in balance starts on average at age 50. And then we also talked about numeric age, which is meaningless. So what do I say? Forget the numeric age. If you are relatively fit and you're capable of doing all these things, forget this one. do it all. Work on your aerobic, work on your strength, work on your balance. So let's talk about that a little more. So to prevent falls and promote fitness and healthy aging, a casual walk is not good enough. I'm sorry to say. So a lot of people say, well, I walk, at work and I walk here. Casual walk, I wish I could say is good enough, but it's not. I mean, it's better than nothing, okay, but it's not good enough, and we're not aiming for just good enough, right? So aerobic activities, moderate to vigorous, strengthening balance, and then flexibility also helps. So good evidence shows that if you spend moderate to vigorous amount of activity, that decreases your frailty score, decreases your disability, and decreases your falls. So what does moderate to vigorous aerobic activity look like? So moderate is sort of like biking, skating, a brisk walk. So not a saunter, not like a lazy walk, but a nice quick brisk walk. And then a vigorous, you start getting into things like swimming, cross-country skiing, basketball. So somewhere in between that, or more if you can, is what you should be aiming for, if you can. And then muscle strengthening and balance, why is that important? Well, to have good core stability, you have to put effort and energy, you have to work it. And that will reduce the risk of falls and disability. So there's core muscles involved, in your abdominal muscles, back, your quadriceps, triceps, and all along the posterior chain and so on. And if you are able to be straight, that reduces your risk of falling. If you sort of look like this, you end up then needing a walker or a cane, and then your risk of falling increases. So you always want to aim to be straight, but that takes effort. So what do? Well, engage in a sport, any sport. That will automatically help with your balance, strength, and aerobics. So that's the easiest way of doing something. So like a martial art. So for the late bloomers who don't generally play sports or haven't played sports, there's a lot of sports that are coming up that are good. Pickleball, swimming. Sorry, a very sensitive mouse that I'm not used to using. Take lessons. If you don't know how to ski, don't sit there and sulk about not knowing. Go and get lessons. Same thing with skating. And then to engage your balance and resistance and aerobic activity. If you don't know what you're doing, get a personal trainer. Yes, it is a little bit of an investment. But if it's a worthwhile investment, it's worth investing into for those who can, right? They will help you. They'll show you how to activate your core muscles. If you've sat all your life doing nothing or just doing minimal physical activity, your core muscles likely don't know even how to activate. You're probably using a lot of sort of muscles that generally don't or shouldn't be activating. You're using that. So people who do personal training will teach you how to activate your core muscles that we just looked at earlier. They'll show you proper exercise techniques, and they'll tailor your exercises to your level of fitness or frailty or wherever you are. And I do encourage group training. You encourage one another. Okay, so that's that. And then there's a website called vivifrail.com. So for those who are sort of in between workouts, they're at work, maybe post-hospitalization or away on vacation, there are exercises that you can do alone. So I won't get into the specifics of it, but you can certainly just look at the website here. And this is published by Merchant et al. So it's peer-reviewed, evidence-based, guide, stuff that can help. Okay, so other benefits to exercise and physical activity beyond just reducing your falls. Well, it reduces the risk of developing chronic disease. If you don't already have chronic disease, it reduces the risk of developing type 2 disease, cardiovascular disease, various types of cancer, osteoporosis, stroke, depression, arthritis. And for those who already have chronic disease, it can also help you in that area. You can reduce exacerbation. So if you have COPD, reduce symptoms. So if you have, for example, autoimmune disease like IBD, it can reduce hospitalizations. It can improve your overall functioning, quality of life, survival, and mood and anxiety. So like this one article says here, this guy's by Anderson et al., they say exercise can be viewed as medicine. Okay, so it's medicine. So we looked at falls prevention in sort of the more robust or fit group of individuals. What about in sort of the middle group here, sort of the vulnerable to mildly frail? So what do we do here? So it's sort of this group here. maybe having difficulty with the more strenuous activities like gardening, yard work, and shoveling, but still able to manage their own bathing, dressing themselves. Or people that have slowed down a little bit compared to 10 years ago, but they can still do some light yard work, light shoveling. So that's the category that I'm sort of speaking to. Well, in this group, this is sort of the sweet spot. Brother here. Okay, yeah. So this is the sort of sweet spot. So individuals here likely have individuals with a history of some deficits, okay, may have the most to gain from exercise. So right here. So this is a critical window. So this may be sort of the last stop to help you traject your way away from being frail or being frail too early or having disability too early, okay? So this is sort of the last, so you can do so. So right here is sort of the last checkpoint. So when I have patients, while I'm managing, their heart failure or whatever other issue, I always say, look, this is in addition to all this medication stuff and so on. It's really important that you get help to exercise in this window because this will help you with quality of life here. Okay. Yes, exercise is critical. So yeah, I've said all this stuff. So if you even in this stage, it can help you with your cardiorespiratory function, physical activity, functional independence. So you can preserve your independence either till you pass, or you delay the process of that decline. It'll help you with your muscle strength and balance, reaction time, postural sway. So if you improve your reaction time and your ability to sway, so if you see something, you can quickly get out of the way, your falls risk with injury declines. And so the evidence here suggests you should be doing resistance training 2 to 3 times a week. So I won't get into all the specifics of what all this means, but to a level that's still moderately frail, you should still be able to, you shouldn't be able to comfortably speak. You should still leave you a little breathless. So still a fairly reasonable amount of vigor in your exercise. So balance, flexibility, and aerobic. You should be doing that, for at least 60 minutes or the best you can. Right. And the aim then becomes to try to sort of be this blue line, healthy aging with activity. So you may not be able to necessarily play, intense basketball, but you still be able to hopefully still shovel, do some meaningful, heavier activities at home, and certainly miss being disabled. So still being able to manage your own bathing and so on. So that's the goal you want at this stage. And so for that, for those who are sort of vulnerable or just pre-frail or those who are mildly frail, there's exercises that you can do on your own. Again, I still suggest you get somebody who can help you, like a personal trainer, a physiotherapist, or somebody who who's well-versed in this area to get you started if you haven't. But you can always sort of supplement with these exercise routines here that you can check from this website. Okay. And so see, this is it's just nice to see a picture. Pictures are worth a few thousand words, right? People are doing it here. So they have both resistance here, aerobics, and so on. Okay, and this is, a 102-year-old fitness trainer. So she's sort of in that sort of mildly frail range of things. And she does fitness instructing for the last 15 years. And people in her sort of facility are inspired by her. They attend her classes at least 4 times a week. And she says, we have a couple people, we have one girl that had a stroke and another one who's got arthritis. And I just tell them, I don't care what they do, but move, so that's her advice to them. But that's great. So we have a bit more inspiration, I would say. So, right. We have a video, somebody who, at least inspiring to me as well. So. I don't know, Zoya, do we want to play this one?
पहले हमने आधा किलो से उठाया, फिर धीरे धीरे 10 किया, 15 किया, 20 आके कर रही हूँ. मैं आके 20 किलो तक उठा रही हूँ. पहले हमने आधा किलो से उठाया, फिर धीरे धीरे 10 किया, 15 किया, 20 आके कर रही हूँ। साड़ी पहनना वो तो अपने अपनी इच्छा के अनुसार है, जिनको जो भी पहनना पसंद करते हैं वो पहन के कर सकते हैं। और वजन उठाना, कसरत करना, ये सब अपने ताकत के लिए करते हैं कि शरीर में ताकत आएगी तो हम कमजोर नहीं हो पाएंगे। और कुछ भी नहीं करते तो वो नसें आके सब ब्लॉक हो जाती है, जगड़न होती है। इसलिए अपन कुछ कसरत करना जरूरी है कि कसरत करते रहते हैं तो अपना शरीर हल्का भी रहता है, अपन सब कुछ काम कर सकते हैं। मेरा शरीर में बहुत कमजोरी आ गई थी और दूसरा के कोरोना के कारण हम कहीं भी जा नहीं सकते, बहुत जगड़न हो गई थी शरीर में, हाथ पांव बहुत कमजोर होने लग गए। मेरा पोता जिम में है, उसने बताया कि आप लोग सब ऐसे करेंगे तो ठीक हो जाएगा, आपको ताकत आएगी और आप ताकत से आगे बढ़ सकते हैं। जो उसने बताया कि माँ जिम में आके सब ऐसे करते हैं, आप बचपन जो जो काम किए वो वापस करो, वो शुरू करो, उठो बैठो, कुर्सी का सहारा लेके उठो बैठो और फिर बेल्ट पकड़ के खींचो, खड़े होके पाँव को ऊपर नीचे करो, कुर्सी पकड़ के करो। ऐसे धीरे धीरे करते करते मेरा हौसला बढ़ा और मेरी नाड़ियाँ खुलने लगी। हफ्ता में 3 दिन करते हैं कसरत। ये कसरत करते करते अपने को भी हौसला होता है कि अपन करेंगे। एक दिन रेस्ट लेते हैं, 2 से दिन करते हैं। हाल के 3-4 राउंड लगा लेती हूँ, सीढ़ियाँ चढ़ती हूँ, 15-20 सीढ़ी है, छत पर जाती हूँ, छत पर वॉकिंग करके आ सकती हूँ। और मेरा सांस भी कमती फूलता है, मेरा सांस आके फूलता था। दवाई आके 5 बार 6 बार लेना पड़ता था सुबह शाम, अब एक टाइम लेती हूँ। जितनी दवाई लेने से भी ताकत नहीं बपरी, उतने अब ये काम सब करने से मुझे ताकत आती है। सही में कसरत करती हूँ, वजन उठाती हूँ, थोड़ा मुझे हल्का लगता है शरीर में। कसरत करने के लिए डरने की जरूरत है, उल्टी हिम्मत रखनी चाहिए कि अपन एक दिन दुखेगा तो दुखेगा, दूसरे दिन बरोबर हो जाता है। 2 घंटे के लिए दर्द होता है, मेरे भी दर्द होता है, मैं 2 घंटे आराम से बैठ जाती हूँ, पीछे हाथ पांव धीरे धीरे करती हूँ, फिर वापस सेटिंग हो जाती है बरोबर शरीर की। हर कोशिश करना अपना काम है, डरते हुए नहीं करो, खुशी से अपन करो कि मुझे हाँ करना है, मुझे तो मैं करूंगी।
Gosh, wasn't that inspiring? So I was quite inspired by that. So I kind of mentioned this earlier, and I do it again because I feel like it's a very important point. Invest in physical activity and where needed, rehabilitation. So participate in group exercise sessions. That gives a lot of people confidence and motivation as a group to do it. There's something about doing something as a team or as a group. So I think there are community exercise groups. Plug into one of those. Strongly consider a personal trainer to show you how to exercise. If you have never done it properly before or haven't done it at all, it's worthwhile investing in a few sessions to know what you're doing, to know how to do it properly, to know how to do it safely. That will give you confidence. And if you have had injuries or you've had an acute illness recently, you've had surgery recently, participate in the rehabilitation programs that they have for you. And if they don't have it where you are, ask your family doctor to get you in touch with physiotherapy and occupational therapy. It's very important, I would say. So we've looked at falls prevention strategies in the robust, sort of in a pre-frail to mildly frail, or the vulnerable to frail and a mildly frail group. What about those who already have a degree of disability or dependency, needing to get into the bathtub, needing somebody to help them get up, having difficulty putting on their clothes, needing supervision in the showers, difficulty climbing stairs? What do you do for them? So we're sort of looking at this group here, sort of the moderately frail to sort of getting to the severe frail side of things. So in this state, it's difficult to exercise. It's difficult to exercise is hard. It's difficult to achieve the ideal moderate to vigorous activity. People have difficulty exercising as long as what's ideal. They're unable to exercise as often. They're already at higher baseline risk of falling. They already have quite a bit of sarcopenia or reduced muscle mass or strength, reduced balance. They often have hindering or progressive medical issues. They may already have dementia, which also adds to your fall risk. It makes it also difficult to learn how to do new things. So is there any benefit for exercise or other fall prevention strategies in this group? Or they just get written off? Which is what tends to happen sometimes, unfortunately. The answer is, the answer to the question of is there any benefit? The answer is yes. But it needs to be structured. You need a structured exercise program that involves strength and balance, just like the others, a bit of aerobics, the best you can, some flexibility. And still, if you can, 30 to 45 minutes a week, 3 times a week in a couple of studies, or at least in one strong one, it showed 5 or more months. And so you think, well, gee, people that are already quite at that level of frail, have that level of disability, can they even do that? Well, studies that show that they can have shown at least 75% to 100% compliance. So for people who enrolled, a good number of them were able to keep up with this structured activity, exercise, for at least 5 months or more. And ideally and practically, you need supervision. So if you're already at high falls risk, you have difficulty balancing and doing strength exercises, well, you can't just expect them to do it on their own. They need somebody there. And it's ideal to have a professional, somebody who knows what they're doing. So even compared to the other groups, it's even more important to have somebody who knows what they're doing, to show you what they're doing, to show them what they're doing, and to have an exercise plan. And there are benefits. And of course, the extent of benefits vary per individual, but on average, the studies show that even in this group, there's improvement in walking speed, improving in mobility, distance. So some people in facilities or at home need to get to their dining table or whatever it is, they can get to that level. Even in those who use wheelchairs, if they're kind of shuffling with their feet, there's improvement in their ability to do that. Improvement in balance, those are residual balance abilities, can do that. There's improvement in functioning, reduced in time to further disability. So even their rate of disability is less, the rate is less. Reduce falls, and they're reduced to falling for the first time. So that reduces. And then there's a reduction in fear of falling with this. So people ask, well, is there going to be any harm in exercising? Are they going to fall and injure themselves and break themselves and so on? So all the studies, the major studies showed that there's no adverse effect with exercising in this state. There's no risk. There's no major risk. There's no harm. And at the most, you might feel muscle aches, but that can be a normal part of exercising. Just like that lady in the video said, she felt quite a bit of muscle aches afterwards. And for anybody who actually does exercises, especially after a long period of time, I've been there, you do feel muscle aches. And that's, you can kind of wear it as a badge of pride that you did some good exercise, right? Okay. So for these individuals as well, there's some recommended exercises. Again, you can look at this website here. They can sort of tell you what to do. So, if you need people, they can help you with sort of things like getting up on the chair, which is helpful. And other things they can sort of do on their own. Right. Okay. So now there are limits to everything. So not everything is, a pretty rosy picture. There are key limiting factors for the ability to do exercises. If you have severe frailty, it's going to be very hard. Your fall risks are already high, or you can no longer fall anymore because you can't get up anymore, right? For those with severe dementia, not only do they have difficulty learning new things, but they forget even how to walk or move. So they have, motor apraxia is what we call it. And if you have severe medical issues that leave you, maybe all the time really breathless, or edematous, full of fluid everywhere in your body, or you have COPD that's severe, that even a little bit of movement throws you off. That's not reversible. That can limit your ability to exercise. Okay. And so these are sort of what we call intrinsic contributing factors. So in these individuals, if they're still at falls risk, then your external or extrinsic contributing factors become important in falls prevention. So for example, your home environment. So we've talked about frailty, sarcopenia, we've talked about intrinsic factors briefly. So we're looking at extrinsic factors for falls prevention. So what can you do here? So studies show that so fall hazard interventions at home are effective in reducing the rate of falls when targeted to people at a high risk of falling. So those are individuals who have fallen in the past year or have recently been hospitalized, who need support with daily activities like bathing. And it hasn't been very effective for those who are not at high risk of falls. I think that makes sense, but it's just nice to know. So what are some interventions at home? So you can do, home safety assessments. So often that can be done by an occupational therapist. Your family physician can make a referral, or if they're leaving the hospital, you can ask the physician who's looked after the loved one to make a referral to a home safety assessment. So they can look at things like assistive devices, walking aids, anti-slip devices for shoes, education to reduce environmental risks. So, for example, if the loved one is still kind of cooking a little bit, rather than having kitchen supplies at the bottom, try to have them in easy to reach locations. Try to have, heavier items in lower cupboards, for example. And then home modifications, so things like grab bars, they assess for tripping hazards, proper lighting. So those are some interventions that can help. And then many people then require additional support. So personal caregivers. So if they have a hard time bathing, they might fall if they try to get into the bathtub. So they might need a personal caregiver. They might need home care support to help with the same. And then for some people, if you're not able to have that or have it consistently, you may need to consider going to the next level of care, supported living. It becomes a sensitive issue, but I would urge you to think about those things before you actually end up with a very bad fall, break a femur, break a hip in a bad way, and then it's game over. And then you're sort of forced into something like long-term care where you can't even do a whole lot of, where it's minimal, limited exercise. So if you're starting to see people who are starting to fall or needing help, be proactive, even about the sensitive issues. Okay, right. So we talked about causes of falls. We then talked about falls prevention strategies at the various stages. Well, what about concerning factors that are associated with falls? When should you be very concerned, seeking, for example, medical attention sooner than later or right away? And this is at all stages, right? Fit to frail. So this sort of speaks to a little bit of intrinsic risk factors and precipitating factors. Okay, so if you have pain, okay, or difficulty with bending and moving, that is not normal. I hear this, and it needs to change. I hear this quite frequently. People say, "Well, I'm just aging," or "Oh, they're just aging, so it's okay that they have hip pain or they can't bend." If you do that, your trajectory of frailty will go down so fast. and then your falls risk will just increase. So do not neglect these early symptoms. It's not part of a normal part of being 50. It's not a normal part of being 60, 70. If you're trying to get them, get it checked out early. Talk to your family physician. Advocate for yourself. Advocate for a loved one. I think there's still some of my colleagues who might still have that mindset where you're okay for a 70-year-old. I think you have to advocate. Seek rehabilitation sooner than later. Physiotherapy, occupational therapy can identify problems. And then in some instances where it's quite nagging, the pain or the disability, or it's come on quite quickly, you can see somebody like a physiatrist, not a psychiatrist. Psychiatrists are helpful for lots of things. But for a particular issue that I'm talking about, physiatrists, or they're called physical medicine and rehabilitation, or PMR specialists. And their aim is to enhance and restore functional ability. They help manage acute and chronic pain, and they diagnose and manage neurological issues, musculoskeletal issues, and injuries. So that's a specialty you should keep in mind. You can consider referral to geriatric medicine, who can help you. They can connect you to these people, or they can diagnose you with the problem as well. Get the family physician to refer you to the appropriate specialist for whatever reason you're experiencing pain or disability. And make sure you don't ignore pain. It's good to get good pain management. So I just want to give practical advice and examples. So that's why I'm putting this up here. So these are examples of physiatry clinics. So I don't get any benefit from sort of, I might know some people here, which is why sort of I feel comfortable putting it up, but I get no benefit from them. So I just want to put that out there. So for example, in Toronto, Mississauga area, there's the Ability Clinic. So there are physiatrists there, neurologists there, rheumatologists that can help you function better. In Edmonton, we have body restoration in a few areas, or there's physiologics. They can help. I only say this because I send some of my patients here and they find it beneficial. So I'm giving you the same, sort of suggestion as well. Okay, so, but of course, it's not just limited to Toronto and Edmonton, right? Just, yeah. Right. So when should, so in addition to chronic, so new pain and new aches and so on, when should you start getting worried? Well, I'll tell you when I start getting worried. When fit people start falling suddenly. So it doesn't matter if they're 80 and fit, 70, 90 and fit, we looked at what fit looks like. If they start falling suddenly, there is a big problem. That's an alarming sign. Get it checked out right away. So in my practice, I've looked at things that have come up, Guillain-Barré syndrome. So it's an autoimmune disorder that starts chewing away at your nerves. You end up becoming weak. You need to get, right away. You need to have special medication pumps through you to clean the autoimmune stuff to help you out. So I've seen several of those. And in a couple of these instances, when people are numerically older, they've gone to a few doctors or emergency departments and say, well, of course, you're getting weaker. That's normal for aging. No. If you're fit, you need to make it clear that this is new and you're concerned. Other things I've seen are compression, fractures in the spine or spinal stenosis. When we've had this problem, we've got the surgeons to see them right away, fix the problem in their spine, and almost right away the problem gets resolved. With various heart issues as well, severe infection that's brewing, septic arthritis, so inflamed joints because of infection or other things. Of course, can happen rheumatoid arthritis as well. Syncope, passing out, many things can do that. Blood clots in the lungs, for example, or a stroke. So my point here is, well, you don't have to learn all this stuff, but if a fit person is falling, doesn't matter what age, don't normalize it. Get help right away. Okay. Now, if somebody has existing medical issues, like visual impairment, cataracts, lung conditions, heart conditions, get it optimized. Make sure it's treated well. If you have COPD, make sure that your family doctor or your specialist has you on optimal treatment for it. Because again, if you have comorbidities, it can make your frailty faster and your falls are going to increase. So suboptimally managed diseases accelerate frailty, reduce intrinsic capacity, increase falls. Also, you want to make sure that if you might fall, you have high falls risks, that you have strong bones. So get your family physician to assess you for osteoporosis. See if you're at risk for it. If you are and you have it, they can put you on treatment for it that can help you. So if you do fall, hopefully you don't break anything and hopefully you don't break too many things. Okay. So what are other concerning symptoms before fall? So these are more insidious. If these sort of starting to happen months before your fall, lightheadedness. You're starting to become lightheaded for not a good reason, right? Loss of consciousness, the room spinning, weakness, shortness of breath, your limbs are swelling, your joints are swelling, chest pain, unintentional weight loss. You're losing more weight than, it's not like you're doing intermittent fasting or you're, exercising too much. That could be a problem. Ongoing fevers and chills, night sweats, neuropathy, loss of sensation, changes in vision, changes in memory and cognitive functioning within a year. If you're generally slowing down, some people have Parkinson's disease developing, they have no idea. They may not have obvious symptoms other than just slowing down initially, And of course, we talked about pain. If you have worsening headaches, if you've taken a new medication and now all of a sudden you're starting to feel imbalance, some changes, those could be signs of underlying medical problems that require attention as well. So if you don't have a family physician, you get one. And if you do have one, make sure you advocate for yourself and mention these things. Those are not normal in aging. People tend to normalize too many things in aging. You've looked at how in healthy aging, you shouldn't have these problems. Okay. So what are concerning symptoms after a fall? So if somebody's difficult to rouse or awaken, that's an emergency, I would say. Get them seen right away at the hospital. New or worsening confusion, that's a problem. Worst headache, changes in vision, new weakness after falls a problem. Limiting pain, that's functionally limiting pain. Shortness of breath, chest pain, lots of bleeding and bruises can be a problem, especially if you're on a blood thinner. There's a chance that you might have internal bleeding, okay? Or you might be losing quite a bit of blood, and that can be a problem. If you're getting fainting spells, and if you're starting to have recurrent falls after your first fall, that's a problem. So get seen, I would say, almost right away. So we've talked about all these issues: intrinsic capacity, falls, relationship between falls, intrinsic capacity and quality of life, causes of falls and risk factors, falls prevention strategies at various stages. And we've talked about concerning factors associated with falls. So back to the quiz, when is the best time to start falls prevention practices? While you're still fit. So while you can still shovel snow, sit on the ground in Jamaat Khana and get up, do gardening. Don't wait till you start. But I would say start wherever you are, at whatever stage you're at. It's still beneficial. So this is the ideal answer, but start now if you haven't already. What age does muscle strength and balance start to decline? So we looked at ages 40 to 50. So yeah, on average, right? Some people maybe a bit earlier, some people maybe a little bit later, depending on your sort of personal profile, but on average. So I would say exercise for the level of your fitness, not your numeric age. Okay. When can a tailored falls prevention strategy be applied? 65, when you need a cane or walker, when you have difficulty getting to the bathtub, or when you can still shovel snow. So hopefully by the end of all this, you've appreciated that you can have a tailored falls prevention strategy at any state, whether you're fit, pretty frail, mildly frail, to getting towards moderate to severely frail. There's lots of things you can still do to prevent falls. And in summary, falls are not part of healthy aging. Falls are a marker of disease and dysfunction or heightened by it, and they're not a part of healthy physical and cognitive aging. We talked about intrinsic capacity or reserves or fitness and frailty, which is a sign of true aging versus our normal chronologic aging. We talked about the interrelatedness of diseases, falls, and dysfunction. We looked at contributing factors for falls, intrinsic, extrinsic, precipitating factors. We looked at exercise as a key intervention. We also looked at other interventions as well. We looked at the benefits of exercise in reducing chronic disease, complications, but also reducing falls. We also looked at some extrinsic factors like home interventions that may benefit some of the more frailer individuals with falls. And we looked at concerning factors prior to and after falls. So one thing I want to say, which some members of the health board reminded me to mention, is if you have individuals with health issues or concerning issues, you can get some advice at the Health Navigation Service, or formerly known as MAS. This is their contact information. You can leave a voicemail 24/7, but there is a life agent available on certain days from 2 p.m. to 6 p.m. local time that can help you navigate through your health process. Right. So this is the end of the presentation. I'd like to personally say thank you to Omid Jamal and Zoya Panjwani for coordinating this presentation on behalf of the Health Board of Canada, and of course for the audiovisual communications team. I think we have Tusman here. These guys like to stay behind the curtains, but there are hardworking people here who make this possible for all of us. So I'll leave it open for questions. I think Zoya, you may have some questions.
Thank you so much, Dr. Rajabali, for that very informative and inspiring presentation. Let's just dive right into the questions. You mentioned exercises for frail individuals, and I was wondering if you could provide some practical strategies to address the fear of falling during exercises for these frail individuals.
Right. Well, that's a great question. Well, yeah, the fear of falling typically occurs, I think, as you alluded to, individuals who are sort of in a mild to moderate and beyond range. So individuals with a sense of balance, strength is not good as what was before. They may have issues with their vision. or medical issues. Individuals who may have already had their falls or near falls episode. So they're the ones who have the most fear of falling. So for the first sort of exercise program, I think a key strategy is to ensure that they are in an environment that reduces that fear. So while also increasing the chances of successful exercise program. So what to do with that? So ideally, it'd be nice to have somebody supervise them and guide them. So ideally, a physiotherapist or a personal trainer. They've dealt with people in this capacity, so they know what they're doing. Of course, you can have family members, but it'd be better to have family members who are confident in knowing what they're doing. I don't know how many of them there are out there. There probably are. So if you are, that's good. But if you're not, get somebody who knows how to help. Ensure proper footwear. So if you're exercising, you need to have a good balance. Optimize sense perception. So people have issues with their vision or hearing. Make sure that they're wearing their glasses and hearing aids, because that helps with their sense of balance, right? And then avoid exercises that might, have a high risk of falling. So, you may have been a great bicycle rider or cyclist, but if you have issues with strength and balance, maybe don't go to that first. Maybe a stationary bike, or maybe consider a swimming pool or swimming exercises where the water sort of supports you. So I would recommend some of those strategies to reduce the fear of falls.
So can you mention or can you provide some specific advice or interventions that family members and caregivers can implement to support their older loved ones in reducing the risk of falls?
It's another good question. Part of it relates to what we already mentioned, but it's worthwhile saying it again. So the best thing you can do is encourage somebody and empower them through exercise. How you can do that is you can connect them with somebody who knows what they're doing. So, we talked about knowing how to engage your core muscles, your posterior change, all the things that keep you upright, how to do proper aerobic activities and balance exercises. Who knows how to do that? There are people in this world who do, personal trainers, physiotherapists, so connect them with that, especially if you're not well versed. The second thing you can do is you yourself engage with the loved one. Why? Because it encourages them. If they have another loved one exercising together, it's great. But it also teaches you what to do. So then you can help them sustain that exercise. And 3, it helps you as well. You're also practicing healthy aging and falls prevention strategies along with them.
That's a great point. So you mentioned earlier that medical concerns can contribute to falls among older adults. Could you elaborate on the role of medications and maybe their potential impact on fall risk, and what steps can be taken to then mitigate these risks? And what are some things one should ask their healthcare provider when it comes to falls?
Okay, that's another great question. Right, yeah, so you're right. Medications can increase falls risks in some people, and particularly those who are also starting to have diminished intrinsic capacity. So there's lots that can be said about medications, but one thing I would say is that some people maybe on medications that were reasonable or at a reasonable dose for them years ago, but now maybe either too strong or the side effects may be more prominent, especially as their intrinsic capacity or their reserves diminish. So for example, there's some people who may be on blood pressure medications, and the same dose from 10 years ago, 5 years ago, which was good, now might be a little too potent. So they might lead to things like feeling lightheaded because their blood pressure is dropping, especially as they stand up. And then that could lead to falls. Some people may be on diabetes medications that can push their sugar levels too low, or what we call hypoglycemia, where they get sort of more confused, blurry vision, you can get lightheaded, pass out, and then you can fall and injure yourself. So not all diabetes medications cause hypoglycemia, but things like insulin and medications like glipizide or glyburide can, for example. There's nothing wrong with these medications. People are on them, but they can in some people, And so what you would have to do is, again, in this situation, if it's an emerging issue, let your family physician know. Often they can just manage it. If it's happening way too fast and you're falling quite a bit, you might want to even think of going to the hospital, because not only could it be a medication issue, you could have an underlying medical problem. Now, if the symptoms aren't urgent or they're mild, you talked about your family physician. If they're not too well versed in making adjustments, they can consider like a referral to a geriatrician who may help with optimizing or adjusting your medications. Yeah, it's a very good question.
Thank you. And so finally, in your experience, what do you consider to be the most challenging aspect of promoting healthy aging and falls prevention? And do you have any success stories or case studies that maybe demonstrate the effectiveness of this approach?
Oh, that's another excellent question. Yeah, so it's the biggest challenge, I would say, is perhaps the biggest challenge would be, I think, not seeing sort of exercise and lifestyle changes that help to promote healthy aging sort of as medicine or a type of medicine, right? And part of it is because I think in sort of modern medicine, even as physicians, I think we've generally been guilty of not promoting it as such. So I'll say yes, okay, but I've changed, okay. So I've sort of seen the light over the years in my practice, and so which is why I'm here promoting it because I think it's so important. So that's sort of one thing. The culture is evolving. The second thing is, if for those individuals who haven't exercised in a long time or haven't at all, there's an inertia. It's very hard to start doing something that you haven't done in a long time. It's like anything else that you haven't done. And so the idea of thinking about it becomes a challenge. So what would I say? Well, the other thing is probably, which is sort of in a situation sort of I'm in, for individuals that are not retired, which is sort of mid-stride, where you have work commitments, you have maybe little kids, you also have, parents and others who you're sort of there for, right? You have lots of things happening. Carving out time can be difficult. So what do you do? So the first thing I would say is if you're not used to exercising or done it before, I think just going to somebody who knows what they're doing will be a game changer. So physiotherapist or personal trainer. Picking up an activity or a sport is the easiest thing. So dancing, boxing, pickleball, that will get your juices flowing. I think you'll see the joy in being healthy. In fact, you'll want to do better, and you'll probably do things that will help you reach that goal. So you have to start somewhere. You have to light a spark. That spark is picking up on an activity, group activity, sport, or just getting somebody to help you. You need to invest in that. For people sort of in sort of my cohort, it's hard. And I personally, it's a personal difficulty for me, but I try my best. And I accept that there's going to be months and weeks that are good, and there's sometimes it's going to be challenging. But what I find is the more I try, when I do fall off that horse, it's easier to get back on again. It's not like the first time when it was very challenging for me to get on, right? So even I remember the time when it was challenging. All right. So you asked about success stories, right? I don't have any one particular success story, but I have to say, the biggest interesting observation I saw was before COVID hit and then during COVID and after, right? So in my outpatient setting, so I was mainly managing patients with Parkinson's at that time, where you kind of, different ages, 50, 60, 70, 80, but different levels of reserves and frailty and functioning. And what was interesting is there were people who were already getting on to good healthy aging practices. They had either a personal trainer, they're involved in boxing, dancing, and so on. And there were those who weren't. And so those who were sort of frail but still active, with COVID, where there was little activity, they managed to hardly decline in their functioning and ability to, be active because they still kept up with those practices. Versus those who didn't, you could see the decline. All of a sudden, the wall wasn't available for a walk. They weren't going out as much. So that bit of activity that they had, they no longer did. So that contrast sort of reaffirmed that those with good practice beforehand, even when you go through a pandemic, you can still be resilient through it. Right. So that was a bit of a success. Yeah.
For sure. Well, thank you so much. And with that, on behalf of Agcan Health Board Canada, I want to express my deep gratitude to you, Dr. Rajabali, IA Canada communications teams, and all the volunteers who've helped behind the scenes with this. So thank you so much. Yali Madad.
Thank you, Zoya. Thank you, everyone.